So today I'm going to talk about the Foley catheter and how to remove it safely, okay? So the Foley catheter is a tube to drain the urine from the bladder. And the Foley catheter has an anchoring mechanism, the balloon, so that when it plays into the bladder, this one will prevent the catheter from moving out. However, if you yank it out very hard, and some patients did that in the hospital when they got confused and agitated, they can yank it out. But with the balloon up like this, it will cause a lot of pain and bleeding when it being yanked out. So today we're going to show you how to remove the catheter safely. So first you need a syringe. If you have a syringe, then I can show you first how to remove it with the syringe. So just imagine this is the Foley catheter inside the bladder. So in here, it's not coming out because the balloon is up. So you need to use a syringe and put it into what we call the valve here and apply pressure, so make sure it fits in snugly, and you can see water start coming out into the syringe. And then you can apply some traction, and at the same time you can see the balloon is getting deflated. Okay, and normally we put in about 10 cc of water into the balloon, but be careful. Make sure you keep on withdrawing until no more water coming out, because in some cases the doctor put in 30 cc and sometimes 60 cc. So keep on withdrawing until no more water coming out into the syringe, and before you remove the Foley. So once no more water coming out, just gently tuck it out. But to do it nicely without urine dripping around, I recommend you get a Kleenex, or paper towel or something, and hold on to that and pull the tuck on the catheter and remove it out gently. And remember to put the bag in the gravity direction coming down, so that the urine inside the tube is not dripping out on the floor, but it coming out nicely. And then you have the Kleenex here, when it coming out, wrapping on the tip of that and pulling it out slowly. Okay? Okay, you can stop.
Perfect.
So now I'm going to show you how to remove the Foley catheter without a syringe. So as you know, the Foley catheter is a tube that has a balloon in, so that it can anchor the catheter inside the bladder. So before you remove the catheter, make sure the balloon is deflated, empty, flat. Otherwise, it may cause a lot of pain and bleeding, okay? So this is the technique to remove the Foley catheter with a pair of scissors. So you can see here, the balloon is inflated and it has a valve here. This bigger tube is the tube that connected to the bag, the urine bag. So this is the valve here, and let me put it down still there so you can see. So before you cut the tube that leads into the valve to deflate the balloon, make sure you get some paper towel or towel, Kleenex or something nearby, so that when you cut it, the water inside the balloon will not wet your mattress or your floor, okay? So here you can see, take a look at the balloon, and here we cutting there, and you can see the water dripping down. Okay, and the balloon get deflated, and make sure until no more water dripping down, that is, make sure the balloon is deflated before you gently tucking on the catheter to remove the catheter. Okay, and when you remove it, it's a good idea to have some Kleenex or something around the catheter so you can withdraw it slowly and gently, and be sure that the lower part of the catheter is in the dependent position so that water or urine is not leaking onto the ground, but it coming out smoothly. And just gently coming it out, and when it's out here, wrap it with the Kleenex and remove it. Okay? Okay. It's very important to make sure there is water draining out when you're cutting the tube. There are cases reported when the catheter get occluded with sand or material inside the tube that leading to the valve. And if you cut this and there's no water coming out, be careful, because talk to your doctor, because rarely the channel is obstructed and the balloon is still inflated. If that's the case, don't pull hard on the catheter. That may cause pain because the balloon was still inflated. Okay.